Hello everyone. Now we are going to discuss about the other mechanism of cell death apart from the necrosis and apoptosis. So there are three important mechanisms from apart from the apoptosis and necrosis. First is necroptosis, second is pyroptosis, and third is ferroptosis. So we will discuss them one by one. So what is necroptosis? Morphologically and biochemically, this is similar to necrosis, as the name suggests, necro plus apoptosis. And mechanistically, it is a programmed cell death, similar to the apoptosis. So what is the mechanism of necroptosis? More or less this behave like a extrinsic pathway of the apoptosis. Start with the TNF, which bind with the TNF receptor 1 and stimulate the RIPK1 complex. RIPK stands for the receptor interactive protein kinases. This RIPK complex along with the FADD, dead domain, which is involved in the extrinsic pathway, form a complex which convert MLKL into the oligomer of MLKL. MLKL stands for mixed lineage kinase domain like pseudokinase. This oligomer of MLKL will result into the membrane attack or plasma membrane disruption. After the plasma membrane disruption, there will be a tissue damage, cell death by necroptosis or local inflammation. So how this is different from the apoptosis? Look, this is not dependent on the caspases. This is necroptosis is caspas independent process, and it is associated with inflammation, which is usually not seen in apoptosis. Now we will discuss about the another mechanism of cell death, pyroptosis. Microbes cause cell death in infected cell in pyroptosis. A microbial product which stimulate the cytoplasmic innate immune receptor or react with the cytoplasmic innate immune receptor and ultimately result into the formation of the inflammasome, which stimulate caspas-1. Caspas-1 is a interleukin 1 beta converting enzyme which convert a precursor of interleukin 1 into active form of interleukin 1. As we know, interleukin 1 has an important role in development of inflammation. By inducing inflammation, they recruit the leukocytes and on the other hand, caspas-1 is closely related with caspas-4 and 5 and induce cell death by the inflammatory mediators. Pyroptosis seen in infection with Salmonella, Francisella and Legionella. This is also seen in myocardial infarction. So this is pyroptosis. Caspas-1 and inflammasome along with the interleukin 1 has an central role in pyroptosis. Now we will discuss about the ferroptosis, another form of cell death. Normally, glutathione dependent antioxidant defenses decreases or regulate the synthesis of reactive oxygen species or free radical, but whenever there is increase or very high level of intracellular iron, they inhibit the scavenging or defense mechanism of glutathione dependent antioxidants. So reactive oxygen species goes unchecked and cause the lipid peroxidation of the cell membrane and result into the cell membrane damage. This is seen in some cancer, neurodegenerative disorder and in stroke. Ultrastructural changes seen in ferroptosis is cristae of mitochondria are ruptured, loss of mitochondrial cristae and ruptured outer mitochondrial membrane on the electron microscope. So these are the three mechanisms of cell death we have discussed. First is necroptosis, second is pyroptosis and third is ferroptosis. Thank you.